Welcome to this medicine masterclass on venous thromboembolic disease, in which we'll discuss Virchow's triad, which suggests the risk factors to develop a blood clot. A thrombus, or blood clot, is the final product of the blood coagulation step in hemostasis. There are two key components to a thrombus: the aggregation of platelets and red blood cells that form the plug, and a mesh of cross-linked fibrin protein. Thrombosis is a response to injury intended to prevent bleeding, but can be harmful when clots develop spontaneously. These can go and obstruct blood flow. Common presentations include venous thrombosis in the deep venous system of the legs. These can embolize, break off, and go towards the lung, where they can present as a pulmonary embolus, the heart to give rise to an acute coronary syndrome, the brain to give rise to a stroke, the mesenteric arteries to give rise to abdominal angina. Virchow's triad contains three key features, and the triad states that thrombi are caused mainly by combination or as a result of venous stasis, hypercoagulability, as well as endothelial damage. And this triad was named by the German physician Rudolf Virchow. Stasis is where blood flow itself is interrupted. Atrial fibrillation is a good example of where instead of the atria contracting, they're just fibrillating, which cause a relative degree of stasis. Prolonged surgical operations also lead to stasis, as does prolonged immobility. Patients who are bedbound, not using their calf muscles, or in a long journey also lead to a result of static blood flow. Varicose veins also induce a degree of stasis. The second component, endothelial injury, this can be as a result of trauma, shear stress from hypertension, foreign materials, implants, or chronic inflammation. Hypercoagulability can arise from various conditions that can lead to hyperviscosity of the blood, defects in coagulation factors such as factor V Leiden, deficiency in antithrombin 3, protein C or S, or nephrotic syndrome in which these proteins are released. Cancer, cigarette smoking, obesity also can predispose to obesity. So putting these three things together, we can extrude various risk factors. Physiological risk factors to develop a blood clot include dehydration, obesity, pregnancy, advancing age, and immobilization. Hospitalization is an independent risk factor for developing blood clots, and that's why patients who are eligible are put on prophylactic therapy. Any major surgery where the anesthetic time is more than 90 minutes or 60 minutes if the surgery involves the pelvis or the lower limbs increases the risk of developing a clot. Critical care admissions, acute medical or surgical admissions also increase the risk. Cancers, comorbidities, plaster casts can also increase the risk. Certain medications, such as the prolonged use of the oral contraceptive pill, hormone replacement therapy, and chemotherapeutics are risk factors. Cardiac disease such as atrial fibrillation, thrombophilia, varicose veins with phlebitis, or the presence of previous venous thromboembolic disease or in a first-degree relative increase the risks. Inherited causes include protein C and S deficiency, factor V Leiden, and antithrombin deficiency. Thank you for attending this medicine masterclass.